The gates are shut to most pupils, but like many schools, this one in South London is still running for a small number of key workers' children. The idea of opening more widely next month is worrying the head teacher. She's concerned they won't have enough classrooms or teachers to keep groups small, and asking young children to social distance will be difficult.
You have to think about all the play equipment they would touch. They touch each other, they're in the toilets, they have drinks. All those things would need to be cleaned thoroughly all the time, and it's just not possible to do.
You don't have a cleaning team in the school during the day?
Not during the day. There's a cleaning team in the morning and in the evening, so I'd have to employ somebody to do additional cleaning during the day. And at the moment, as everybody knows in education, money's quite tight.
The government's pointed to other countries where schools have reopened and said, well, if they can, why can't we? What do you think about that?
Everybody has to keep coming back to what's in the best interest of the child and is it safe to do so? And that's the only consideration.
The government wants schools in England to prepare for wider opening from the beginning of next month. It's suggesting staggering starting times and splitting up classes to keep children in small groups.
It is the case that it's extremely unlikely that any school is likely to be the source of a COVID outbreak. Okay. We're confident that children and teachers will be safe. Look, if progressive countries like Denmark can be teaching children and have them back in schools, so should we.
Not what they're saying in some parts of Britain. Local authorities in Manchester, Hartlepool and Liverpool are refusing to sign up to the government's plan. Schools in Scotland and Northern Ireland are unlikely to fully reopen before August or September, while those in Wales aren't working to a June date. And teaching unions say they want more scientific evidence.
When Denmark went to a wider opening of schools, it was when the case rate was quite a lot lower per head of population than it is here. And also then when they opened the schools up, they had a 2-metre gap between children's desks. They had bubbles of children were in a bubble of 5 when they were out in the playground, a bubble of 3 when they were inside. Our government isn't doing that.
Denmark has reported far fewer COVID cases, but also closed schools earlier than the UK. The reopening includes as many lessons outdoors as possible and rigorous hand washing.
I think it's very, very important that you do not just take the Danish example and try and make that fit into the UK, because there's so many conditions that are quite different. I think that would be dangerous. If kids come to school and their teachers do not feel safe, then the kids won't feel safe.
As so many questions remain around the plan in England, even if schools fully open, will parents feel it's safe enough to send their children?
Well, we're joined now from Eastern France by Dr. David Nabarro, who's Special Envoy on COVID-19 for the Director General of the World Health Organization. What do you make of the way Britain has started easing the lockdown? There are more people on the roads, more people meeting up, more people going to work, before having test, track and trace up and running.
Well, thank you very much indeed. I try very hard not to give advice to governments from where I'm sitting if I don't understand fully what they are taking into account as they make their choices. But what I can do is share experiences across countries and show what seems to be the most effective way to get ahead of this virus. It is important that we continue everywhere with physical distancing, with face protection, if that's the recommendation, and with hygiene, as I heard just now in the news report. We've got to keep the rate of reproduction of this virus down as low as possible in our local areas. And then we have to be very, very efficient at suspecting the disease and detecting cases, tracing contacts, and separating people who've got the disease. So yes, having that test, track, and trace and isolate strategy in place across the country is a key requirement for reducing lockdown anywhere where lockdown has been used to get the case numbers down.
Right, what about going back to school? Because in South Korea, which was very successful in tackling the virus, they kept the schools closed for a long period of time.
Yes, I think that the issue of when to restart schools is extremely important. And I note the care that Denmark is taking with trying to ensure that teachers feel safe and that children are kept safe, because I agree with your interviewee that the primary issue is the safety of children. I think that we are seeing experiences in UK schools that have been kept open to look after the children of health personnel. We're seeing in France, where I live, that there are very careful efforts being made to ensure that children are kept as distant from each other as possible. So implementing the kind of physical distancing and bubble approach in the playground is what we consider to be best practice right now.
OK, the British government this evening has just announced that if the Oxford vaccine trial is successful, British people will get a third of all production by September, potentially, this year, which is quite extraordinary. Will the world be comfortable, will the World Health Organization be comfortable with Britain getting so much of that early production?
Well, the decision about vaccine use is entirely one for a national government. Now, what the UK will have to do when the vaccine does become available is to make sure that it's properly tested in human volunteers and then in human populations before it's licensed for widespread use. And the testing is firstly to see whether it works, and secondly to check that it's safe. Now, then it has to be administered, and there will be questions about whether everybody will be ready to be vaccinated unless they've been totally convinced that the vaccine is meeting all their personal concerns. Most of us have been saying that it will be about 18 months before widespread vaccine use becomes possible in any country, and probably more than 2 years before it's possible for the whole world to get it. So I'm very interested to hear the ideas that perhaps it can be happening so quickly. And I suppose, like all of us, we are very much hoping that vaccines will come online as quickly as possible so as to make it possible for economies to recover fast and people to get back to work. But we will also be all the time saying, please make sure they're safe and please make sure they work.
David Nabarro, thank you very much indeed.
Thank you.
Boris Johnson is facing a growing revolt in northern England over his strategy for easing the lockdown, as the Greater Manchester Mayor Andy Burnham compared the measures to an exercise in chaos theory. This, as a poll shows, public approval for the government's handling of the crisis has fallen by 9 points over the last week. Our Home Affairs correspondent Darshna Soni has been to Nottinghamshire, where former mining communities voted Conservative for the first time, to get their opinion.
Lockdown life in Ashfield. This town sits in the heart of the old Nottinghamshire coalfield and was once a brick in Labour's red wall. At the last election, it did the once unthinkable and turned Tory.
I and we will never take your support for granted.
Boris Johnson acknowledged that many in the Midlands and the North had lent him their vote because of his promise to get Brexit done. He talked of levelling up the English regions. But the Prime Minister is now accused of ignoring the former Labour heartlands over the way the coronavirus restrictions are being lifted.
What I have found surprising is how quickly they reverted to the default London-centric approach when the crisis began. And I think if they don't rectify some of that, then I think they will lose some of those votes that they gained.
Mr Burnham says England's regional mayors weren't given notice last week that some restrictions were being eased and that people were being encouraged to return to work. Neither were they given any resources to help.
Last week we saw £1.6 billion given to London for transport there. Now, I'm not against the capital of the country getting the money that it needs, but where was the deal for Manchester, Leeds, Birmingham, Liverpool? Well, there wasn't one. I can't see how that is right or fair when we're dealing with a virus that has clear links to deprivation.
But is he right that the Prime Minister is in danger of losing public confidence? A new poll suggests that approval for the government's strategy is down since last week's announcement. Queuing for her shopping, we met Linda, who works with people affected by the pandemic.
Do you think there needs to be a different strategy for the regions?
Yeah, very much so, because the demographic of the regions varies so much. This is quite a heavily populated area. It's an area of high deprivation. There's a lot of people on housing benefit here, so a lot of people are worried about their jobs.
Everyone should be on lockdown for now.
So you think it's the government's lifting the lockdown a bit too early?
Yeah.
My kids aren't going back to school, not for guinea pig trial. No, I'll wait probably a couple of months, see what happens.
The Prime Minister has acknowledged people's frustration over what he describes as the complex easing of England's lockdown. He says he trusts the good sense of people to follow the new rules. Mr Johnson has also thanked the British public for sticking with the government so far. But with regional splits over issues such as when to reopen schools, how long can that be expected to last?
The government says more complicated messages will be needed during the next phase of their pandemic response. Many here warn they must take the regions with them if those messages are to succeed.